Good evening, everybody. And it's an honor and a pleasure to have these two guests that I'm colleagues of, and at the end of the day, I look up to deeply, deeply. So we really are truly fortunate. So the way it's going to work tonight is I'm going to be introducing Congressman Jim McGovern, and he'll be on for the first half hour. And then I'm going to ask him to make some few introductory remarks, particularly as it pertains to health professionals and the role of healthcare professionals in this year's election, and what you're hearing and so forth and so on. And then secondly, I want to introduce another hero of mine, Chris Jennings, who I've also worked with, and it's a pleasure to have you on, and to really talk about some of the connections and what we can do in terms of messaging. And that's the point that I want to give to both of you, is that what we want to do as health professionals is impact this election. If it's really true that healthcare reform is a top issue, well, what kind of messages can we focus on to help people who really believe in healthcare reform win? So what I'd like to do is start out by asking Congressman McGovern to maybe make a few opening remarks, speak as long as you like. We're going to have him on until 7:30, maybe have a few moments for questions. I'll ask a couple questions, and maybe there'll be questions from the audience that you can put in the chat that the A&D team will be monitoring. Thanks again.
Well, thanks, Doctor. I appreciate it, and I appreciate all your advocacy, and it's good to be on here with Chris Jennings, who I have long admired from when he was in the Clinton administration, but on so many other issues. Let me just open with just one kind of brief statement. I've been doing a lot of in-person town halls lately, and I've heard from all kinds of people, including medical doctors and nurses and other healthcare professionals. They say to me, when they turn on the news in the morning, it's not one thing, it's not two things, it's like 9 or 10 things that drive them crazy, that it's overwhelming, they're exhausted, they feel powerless. They just want to pull the shade and have somebody wake them up when it's all over. And my response to them is that this is a deliberate tactic coming out of this White House. They want to overwhelm you so you feel you have no power, and then you'll retreat and you won't push back. You won't lobby your representative, you won't lobby your senator, you won't protest when they vote the wrong way, you won't thank them when they vote the right way. You'll just withdraw. And we have to resist that because there's so much at stake. As we go through questions and answers, you see what's happening right now. Medicaid cut by $1 trillion, changes to Medicare. Cuts in nutrition programs, threats to cuts to NIH. I could go on and on and on. But as somebody who, like many of you on this call, believe that healthcare is a fundamental human right, we need you engaged. You have credibility on this issue that I don't. I don't come from a family of doctors. I come from a family of patients. And so I listen to doctors when they give me advice. I listen to nurses. I listen to healthcare professionals because you're on the front lines. And so please be as engaged as possible.
Great. So that's a great way to start. And I'd like to start out, since you alluded to the fact that I'm a physician, and feel free to call me Norbert, unless you want to become one of my patients, but that would be a bad idea because most of my patients are actually quite sick. But I want to start out by telling you about a patient who I saw last week. And this is illustrative of the issue, which is to say, I had a patient who came in with shortness of breath, anxious, and I taught her a little bit about how to do thoughtful breathing. And I said to her, are there any other issues that came up? And I'm bringing this up because of your tireless advocacy of not only healthcare, but food insecurity. This young woman had not eaten in 24 hours. And so what we were able to do, because we, several days of the week, we have a food pantry at our practice. And we were able to give her a bag of food. And then to try to figure out a way, because not everybody can just figure out all the rigmarole that have to go through to try to get some additional food.
Right.
So I just wanted to highlight kind of this story for you, because the reality is no food, no health, no housing, no health. So within that spirit, I'm wondering, yes, we are trusted messengers, but what would you suggest to start out with is what are some of the, how should we frame the messages with respect to the ACA cutbacks and so forth? And how can we get those messages across to the voting public?
Well, first of all, you can help connect the dots because oftentimes when we talk about healthcare in Congress, we don't make those connections. And we absolutely do need to make those connections. We live in the richest country in the history of the world, and there are 48 million Americans who are hungry or food insecure. I mean, that's a political condition. I mean, we have the money, we have the expertise, we know what to do. We just lack the political will. But we're trying to you can help make the case that if people get access to good nutrition, that not only is that a good thing to do morally, but they're cheaper. They probably won't develop a lot of illnesses related to bad diets or skipping meals on a regular basis. I did a tour of an emergency room here in Massachusetts, I don't know, a few months ago, and I was asking the doctor who was bringing me through, tell me what are the people here for? And there's all kinds of reasons: chest pains, headaches, all this kind of stuff. And then he pointed out this woman who was there because she was taking her medication on an empty stomach. She couldn't afford both the medication and the food. And he says, "Look, I mean, this is the most expensive form of healthcare. It's cruel that she's in this position. But if anybody thinks that by cutting SNAP or cutting nutrition programs is a way to save money, this is proof that it's not. It's going to cost you more to help get this woman well." And I appreciate, Norbert, your practice having a food pantry. I want every practice to do that. I want every health clinic to be able to offer food to people. I visited a program, a health clinic in Revere, Massachusetts, and they have a partnership with Mass General Brigham and the Greater Boston Food Bank. They have a plant-based food pantry there, and which was great. But people, they realized they know how to prepare the food, so they also have cooking classes there on the side. It is incredibly popular, but here's the deal: the health outcomes are appreciably better. And Mass General Brigham tells me that the costs are much, much lower. So, when we talk about healthcare, it's not just about coverage, it's how do we expand our conversation on healthcare. And you also mentioned housing too. That's another issue too. If you do not have shelter, if you do not have a safe place to live, that also adds to all these other health problems. So helping put everything in perspective is important. And then we got to win elections. We got to win elections. I mean, we can talk until the cows come home about all the stuff that we need to do. But if we have a Congress that votes for $1 trillion in cuts to Medicaid, for example, I mean, we're not going to be making any progress. So we have to help frame the issue. We have to convince our neighbors, our family members. Yes, we have family members that need to be educated. We need to tell them. We need to be engaged with our members of Congress and our United States senators. And we need to be engaged in these elections, and we need to win. If we win, the sun will not automatically come out tomorrow, but we can do we at a minimum we can prevent further cuts, and we know further cuts are coming.
Thank you. So as you know, you and I have discussed before that Ask Nurses and Doctors has a 10-point healthcare agenda, which includes capping medical debt, creating a Medicare option for people 60 and over. I'm wondering if Democrats take the House and Senate, which, if any of these, can realistically be done in 2 years. And I want to include in that reversing some, if not all, the Medicaid cuts and the ACA subsidies. What's realistic? What can we possibly expect?
What I think is, well, it depends what we win. It depends if we win the House and not the Senate, or the House and the Senate. But we still have this guy in the White House. And so I think realistically, no further cuts. Realistically, depending on what the election outcome is, at least a pause in the implementation of these cuts, which will give us time to be able to reverse them. I mean, because we will have power, and he will need us to keep the government running, to move things forward. And so I also think, even if we don't, obviously we're not going to have the White House, but even so, we ought to be talking about what we want. Because the other thing I'm hearing, and I say this as a Democrat, that a lot of people are saying, well, I don't like them, but I'm not terribly excited about you either. What are you going to do to transform our healthcare system? When I was the chairman of the Rules Committee, we held the first ever Medicare for All hearing. Maybe that's not the solution everyone wants to buy into, but I remember we had this incredible man, Adi Barkin, who was dying of a debilitating
ALS.
ALS, and he came and he testified, and he talked about how his family was going bankrupt, just being able to keep him alive. No family in this country should be faced with that. There has to be a better way. But we can use the majority to actually kind of flush out the meat on the bones on some of these ideas, and and hold them out there as what we would do if we controlled government in its entirety. And again, we have a credibility issue because a lot of people were disappointed we didn't do more the last time we held the White House and the Congress. Well, okay, we have to be bold, because it's not going to be it's not enough just to say we don't like that guy and we don't like Republicans. What's more important, quite frankly, is what we're for, and people have to believe that we will fight for it. But we can't. I don't want to overpromise because the president has veto ability, and a Republican Senate can mess things up. But I can say with relative certainty that we would prevent any future cuts from happening, and I think we could at a minimum delay the implementation of this stuff to buy us time to be able to reverse them.
So that's if we win the House and the Senate. Is that the bottom line?
Well, that's if we win the House. I think if we win the House or we just win the Senate, we're in a position to prevent further harm, and I think we have a realistic chance of delaying these cuts. If we win both, we can do even more, and maybe even begin to reverse some of the cutbacks. I mean, look, here's the deal. I mean, we spent $3-4 trillion on tax cuts for multimillionaires and multi-billionaires. I mean, none of it's paid for. And they say that one of the offsets are these cuts in Medicaid, and some of the changes in Medicare. The president's got $1 billion for a new ballroom. I mean, boy, everybody is just on the edge of their seat wanting to see that happen. I mean, and yet, we got to cut Medicaid, we got to cut people's health benefits and food benefits. And now we have a slush fund, $1.7 billion to reward those who try to overthrow our government and attack police officers on January 6th. So, I mean, there is money there, but if we have control of at least one, if not both of the chambers, we have the ability to be able to, to prevent him from doing some of the most egregious things that he's talking about doing right now.
Well, so tied into that, healthcare affordability, and so let's tie this into this question: is healthcare affordability is apparently a top voter concern, and polls show that Democrats are trusted more than Republicans on the issue. On the one hand, on the other hand, there's this credibility issue that Democrats have, or the Democratic brand has. So, what do you think? What do you think it's going to take to get through this message on healthcare affordability, and how should that be framed? And then I'm going to follow it up with another question pertaining to that.
Yeah, well, one is we have to talk about it. I mean, this has to be part of our vocabulary all the time. It's not enough to do one press release and then, or mention it in one speech, or even give one speech. Healthcare has to be brought up constantly. The issue of affordability has to be brought up constantly. I mean, right now, it's even worse for people because gas prices are up. It costs you more money to go see a doctor. Food prices are up. It costs you more to be able to buy nutritious food at the grocery store. And out-of-pocket healthcare costs continue to go up. And, we in the House, even with a Republican majority, managed to force a vote and pass the extension of the ACA tax credit, which was a good thing. Unfortunately, the Senate didn't do anything about it. But that in and of itself is not a particularly stirring message. people want more than just the extension of the ACA tax credit. People tell me now at town halls that it takes forever to get a doctor's appointment. They're telling me their out-of-pocket expenses are more than ever, and they're afraid because of everything else going up that even their insurance companies are going to start limiting, what they cover, and force them to pay more out-of-pocket expenses, which will result in people not going to seek medical care, and especially preventative care. And again, if we're talking, and you all know this because I'm like preaching to the choir on some of this stuff, but it's good therapy for me. So I'm just gonna just put it out there. But I mean,
And I'm not going to charge for this.
yeah, no, well, but you know as well as I do, that an ounce of prevention is worth a pound of cure. You know as well as I do that a lot of times when people finally go to the doctors, it's because something that could have been prevented was ignored. And so if the issue really is how you contain healthcare costs, that is how you do it. And all of you on this call, I mean, I think you all know, I mean, what needs to be done. You know the greed that exists in our current healthcare system. You know where it is. You know where the excesses are. And the bottom line is, we can address this. And the final thing I'm going to say is, I want to make sure that young people want to go into the medical field. I want to make sure they want to be doctors and nurses. I want to make sure they want to get involved in the healthcare field. I talked to a group of students at UMass Chan Medical School in Worcester here, and some of them who were in medical school are telling me just the whole cost of medical education is so crazy, and the kind of practice that they want is not to do. They don't want to do brain surgery. They want to get into being a primary care physician. They're just wondering, will I ever be able to make ends meet? Will it all? Will I ever be able to pay off my debt? Will I ever be able to earn a decent living where I could buy a home? And why one young woman said, "Why the hell am I doing this?" I said, "You're doing this because you care about people, and we need you, and we need more of you."
So within that framework, you and I have talked, and you and I have been to the Democratic Congressional Campaign Committee on a number of occasions. And on the one hand, you're saying that we are the best validators.
Right.
We can really articulate the message. And on the other hand, it's been often my experience, and I think it's often the experience of a lot of other healthcare professionals, is to say, yeah, we want you to be involved, but just give us your money and we're done with it. We're really not that interested in your engagement. So what do you have as suggestions for health professionals who are in this Zoom, in this meeting, as to how we can engage with politicians? Because I can say for sure, you and I have met about this. We've had conversations with different powers that be. But I can say that with different parts of the country, it is not a unique experience where we get saying, yes, we want to talk about healthcare, but in terms of healthcare, we really just don't want to really work with you. We just want your money. How can we change that paradigm?
Yeah. Well, Chris may have more, a better answer. But look, and let me preface this by saying I love the Democratic Congressional Campaign Committee and all the people who are trying to win the House back, and the Democratic senatorial campaign. But they don't know everything. And their job, and they're focused in on money and giving money to candidates, or helping to provide commercials for candidates. And I get it, but I think that's only a piece of the equation. And I think you may have to work around them, and we may have to find out ways to get you deployed in, key congressional districts, key senatorial races, to start talking about this stuff. Because again, a bunch of, I always tell people, I get invited to go to people's districts, and I'm always like, okay, I'll go, but really, do people want to hear from more politicians? If we're talking about healthcare, I'd rather hear from a doctor. I'd rather hear from a nurse. I'd rather hear from a medical researcher. I'd rather hear from somebody who actually knows what they're talking about, not spewing off a series of talking points. And so I think, the challenge in the short term is to figure out how we plug you into those key races. And again, the DCCC needs to do its job, but just more money, for the sake of more money, is not a winning message. And again, I used to work for this congressman from South Boston, a guy named Joe Moakley, and he used to say to me all the time, "People look at life through their kitchen window." And by that, he means, people, think with the things that are front and center on their minds is, when they come home and they sit around the kitchen table and figure out, do they have the money to do this and to do that and to pay this bill and to pay their mortgage and to pay their rent? And can I even go to the Cape Cod for a vacation? I mean, and I think this falls under that category. I mean, people are not getting healthcare that they need because of access and because of affordability. And we can fix some of this stuff. And so much of the money is going to things that are not doctors, that are not nurses, that are not the people that actually keep people well. But, I mean, there's all this other stuff where people are making money, and it's not helping people. And we spend more, and percentage-wise in terms of our population on healthcare than any other industrialized country in the world, and we're the best country in the world to have open heart surgery, but we're not necessarily the best country to prevent you from needing open heart surgery. And I think if we want a system that people will appreciate more and also control costs, we need to change that dynamic.
Before I get to my last question, I'm going to ask Chris, because Jim said that you might have some particular thoughts on it. Would you like to interact with Jim on this issue as to how we as healthcare professionals, and then I'll ask you more about it when you and I are just talking ourselves. Do you have any thoughts between the two of you as to how we as healthcare professionals, because it's not just my experience. I can tell you right now, this is throughout the country, where health professionals are having a tough time. For those who are wanting to be engaged, they're having a tough time to be engaged, other than saying, well, just give me the money. Any thoughts, Chris, on that?
Sure. And first of all, I just want to raise up and commend Jim McGovern, because you can tell he's going out and he's hearing it. And there's a lot of members who don't do that. And you're getting a real sense of meeting people where they are. And one thing that I just want to say, whether it's doctors or members of Congress, we have to redevelop our credibility and trust with the voting public that we get what they're going through. Even before Democrats have this tendency of wanting to promote a policy and talk about it before they've even developed the trust and credibility of conveying that, one, they know what people are going through, and two, they're so frustrated themselves and they've personally experienced it that they're committed individually to get something done, if not for you, constituent, for me and my family. I mean, really, I have to say, we have to start with that, because our trust factor, and this is corporation and it's government, is hugely diminished. Now, who is more trusted than corporations and government and me and a little bit the congressman is the healthcare professional. You want to look at trust factors? Doctors, nurses, pharmacists. I mean, add 40 points of credibility to journalism, to members of Congress, etc. So it's in our interest as policymakers to actually promote healthcare stakeholders to engage. Now, I will say, Norbert, that sometimes healthcare professionals aren't always on message either. And so they have their own prescriptions. They all think they're the best. They're the best one to diagnose and prescribe something, and they don't frequently even agree with themselves. Right. So I just want to be honest about when we have dealt with some docs, they aren't always necessarily completely aligned, if you will. But then I'm going to end with this, Norbert, is one thing you've done is you have brought physicians and nurses together to begin to empower them to be on message, to be unified. And I think I would start there before like doing one-offs. I would kind of do a little bit more collaboration and unifying and seeking clarity, as we were talking about at the beginning, because if we spout out a bunch of differing, conflicting prescriptions, it undermines the message of credibility. So I'll stop with that.
Any reactions to that before I ask my last question for you, Jim, and I'll let you go?
No, I agree. I mean, we got when the message can't be that you need a PhD in medical science to understand it. I mean, that old saying, "Keep it simple, stupid." I mean, that is key. People have to understand it, and and people have to be united in the message. I mean, so if you get 15 different messages, forget about it. But I would just say this: most people trust their doctor. And Robert F. Kennedy notwithstanding. But I mean, most people trust their doctor to give them the best advice and to tell them the truth. And so if you can have a message that is simplified, that it's not 100 pages long to be able to say, and you're united, then I think you can be a powerful force in this election.
Well, I'm going to keep pushing. As part of the 10-point healthcare agenda is a commitment to universal coverage, reverse the cutbacks, and do something to do something about cost control by improving quality. So that's the simple message. But within that simple message, and here's my last question for you, Jim. 30 years in Congress is a long time, and the work is hard. Do you have a moment in the fight for our shared values that made you laugh that you could share with us tonight? There's got to be something that's funny.
Yeah, well, some things are funny that really are not meant to be funny. But I was thinking that those of us from Massachusetts lost a great leader in Congressman Barney Frank recently. And when I first came to Congress, he and I co-represented the city of Fall River, and it was like around the time of the Affordable Care Act fight, and lots of conversations were going on. And I remember being at an event, and he spoke, and then I spoke. And after I spoke, this woman got up and basically said, "You suck. You're terrible. You're awful. I can't stand you. In fact, all you politicians are terrible." And so I was like figuring it was directed at me. And so I went up to answer, and Barney intervened and said, "Push me aside. I'll take this one." And he said, "Yeah, you constituents think that your politicians are no bargain. Aren't that great? Guess what? You constituents are no bargain either." And I remember bursting out laughing. But the reason why he kind of said that was because before he said that, he was asking this woman, like, she was talking to us about healthcare, saying, like, where are your facts coming from? Where are you hearing all this kind of doom and gloom about this new proposal? And she didn't have any. I mean, she was just taking it. It was being spoon fed to her. And so it is really important. And I think the message was, when we have these debates, to make sure that they're based on legitimate facts, that we can source what we're saying, and we can prove to people who may disagree with us that we have the facts on our side. So in any event, nowadays you got to keep a sense of humor, otherwise you go out of your mind. But I'll just close with this. I've never seen anything like what's happening in this country. I mean, I fear for our very democracy. But even having said that, I am hopeful and I am optimistic. I mean, I'm hearing from people that normally don't even get involved that they're concerned and they're ready to take action. So we can do this. And if we win, we need to begin the task of fixing our healthcare system and making it more responsive to everybody. So, but thank you for having me. And I look forward to talking to you soon.
Thank you so much. It's great to have you on, Jim. And we'll be standing by your side, and let's make things happen.
All the best. Thanks.
Bye-bye. All right, Chris, what a joy to have a conversation with you.
Well, it's great to be here, and it was great to hear him. And I can remember when he came in to office, and he was sworn in 1997. And that was the year that we passed the Children's Health Insurance Program. So good luck. He was good luck.
That was a momentous occasion right there.
Yeah. Yeah.
So let's kind of riff off that. First
Okay.
of all, tell us what the Children's Health Insurance Program is, because there are people who are on the call who don't know. And tell us, what happened and how did it happen? I mean, it's really made a big difference. And
Yeah.
tell us a little bit about that. Just let's do a little history.
Well, it's such an outlier of some level of success, and I'm happy to share with that because there's frequently more pain than gain in the health policy game, and that one was definitely gain, but only after many, many years of really terrible defeats. I would even say it goes back to 93, 94 when we didn't succeed in the Health Security Act. That failed. Then Gingrich had his contract with America, which we called Contract on America. That was big Medicare and Medicaid cuts that closed down the government. That's when that was very unusual. The president would refuse to sign legislation to move forward to actually make Medicaid a block grant. And then there was the 1996 election where President Clinton was reelected, and and the Congress did very, very well, but the Republicans were still in power, and we needed to work on a bipartisan basis to do something, and all of us had been tired of fighting. I mean, you almost had to have these big fights before you can step back and say it's time for some progress. And there had been a number of states, including Massachusetts, where there had been some expansions for children's coverage and parents, but very, very limited. And there was limited interest in doing so, or if there was interest, there was insufficient federal dollars for doing so. And as part of the Balanced Budget Act of 1997, working with Senator Kennedy and Senator Hatch and many other members, Senator Rockville and others, and also people in the House, there was a real effort to pass children's health insurance to provide enhanced subsidies for the states to expand coverage. And what was unique about this is it was bipartisan and bicameral, although the House Republicans were objecting. And this was a line in the sand that President Clinton decided to say, I will not sign this Balanced Budget Act unless we have the Children's Health Insurance Program. And it passed and was enacted, and it was bipartisan. And what's important about bipartisan, bicameral, and what did that do? Well, it sort of allowed the most conservative and the most Republican and most progressive members of Congress to vote against the bill. They didn't like the bill. But there's a center-out coalition that voted for the legislation, and it passed and was enacted. And interestingly, when less than 3 years, all 50 states took up the children's health. It was an option, and they took up the incentive to expand coverage for every single kid in that eligibility criteria, which is very, very different when you contrast that with the Affordable Care Act, which was not bipartisan. And we still have 10 states who haven't expanded Medicaid for just people under poverty, if you can believe that, childless adults under poverty. So it's good to know it can happen. I guess the other lesson learned from that is if you can miraculously pass something bipartisan, and I would say the time's probably changed for that, and we can talk about that too if you like, Norbert, but it's far less likely to be targeted for repeal, as the Affordable Care Act was, as you know, back in 2017. And we've constantly had this problem where people who didn't vote for it want to repeal it or undermine it, et cetera. You don't see that with the Children's Health Insurance Program.
So within that spirit, because you've emphasized several times the word bipartisan, so I want to point out to you that we have, for Ask Nurses and Doctors, we have both Republicans and Democrats who we work with.
Yes.
So the question that I have is, today, you work with the Bipartisan Policy Center.
Yep.
which means that you talk to Republicans.
Sure.
So are there any Republicans in Congress right now who at least privately acknowledge that these Medicaid cuts, ACA rollbacks, Medicare enrollment barriers are causing real harm? And is there a path from a bipartisan point of view to move forward? And I guess I would tie that in is to how should we, again, as healthcare professionals, because you saw me trying to, hold Jim McGovern's feet to the fire a little bit in a positive way, I hope.
Yeah.
But the reality is we as healthcare professionals, we're having a tough time kind of trying to say, okay, we want to do this in a bipartisan way. We just want people to be healthy. So are there Republicans out there? And how can we as healthcare professionals make a difference in that way?
Well, sure, there are. They tend to be on different issues, which I'm going to convey to you so you have a sense about which ones there are. But well, I'll start with that. I'll start with the common ground. Okay. So, for example, community health centers, very, very strong bipartisan, bicameral support.
Even today?
Even today.
Okay.
NIH investment, very strong bipartisan, bicameral support. Focusing on competition and transparency, fairly bipartisan. Mental health, chemical substance abuse, bipartisan. Anything with the VA and healthcare, bipartisan. Telehealth, bipartisan. Okay, so these are all examples. It's not an end-all be-all list, but it's a very good example of where there are disagreements. It tends to be in size and scope, but not structure and commitment. Okay,
right.
Whereas if you're talking about coverage, insurance reform, Medicare, Medicaid, certainly Medicaid, marketplace, anything along those lines, very, very, very partisan, almost impossible to bridge. Now, you ask, are there any Republicans who felt the least bit of discomfort with the Medicaid cuts? There were some. They tend to come from marginal districts or semi-purple states, some of whom frequently they're women, by the way, and you'll find them in the Senate, like Murkowski, as an example. There's others, like Senator Collins, who didn't vote for these bills. They didn't vote for them because they didn't need the votes for them.
Right.
Okay.
Right.
But they didn't vote for them, and so given the opportunity, would they be one of a few people, maybe, to reinstate? But it would be a very, very small number, because it's important, I guess, for me to convey that there are a lot of Republicans, and I'm not trying to be in any way political. These are just, they would agree with what I'm about to say, where they believe that Medicaid is there for certain populations, but not for all populations, and people need to be you have to be worthy to get the coverage. In other words, you have to be working to seek that coverage, or to secure that, or to be worthy of that coverage. And they think there's a lot of other people who are ineligible for coverage that are enrolled in coverage. People like undocumented people, or people that they think have too high incomes and have underreported their income, and all sorts of different things. So when you take a position where I'm comfortable with saying two things: if you're unworthy or ineligible, you shouldn't get any coverage, and that healthcare is a privilege, not a right, okay, then you can see, and they would say, right now, the vast majority of elected Republicans would be completely comfortable with what I just said. And they would also say the programs are rife with fraud and abuse. So why should we spend good money after bad? So that's their position. And if the first thing that we say is, let's restore everything that we had before, they're going to say, no way. Now, I should say one last thing, and then I promise I'll shut up, Norbert, is that there is a danger for Democrats or any policy person to say we want to simply restore what we had. And the reason is that most people don't believe that it was perfect beforehand. They would like you to say, I'm going to reimagine, or I'm going to restructure, or I'm going to make it more accountable, or I'm going to make it more worthy of the people that the program serves and the taxpayers who support it. That type of language is enlarging the support for a policy, and Medicaid is actually more popular than people think. But if you just say, I just want to return it to the ways of old, that is somewhat of a trap, because there's a lot of people in the middle who will say it wasn't good enough, fix it, So anyway, I just thought I'd share that with you too.
So that brings me to two parts. Number one, the first is that it still seems to me that, yes, restoring the cuts has to be married, and I like the words reimagining, restructuring. You and I will both agree with that. So we have to say that in the same breath.
Yes.
That's what I'm hearing from you. Is that correct?
Yes, absolutely. Absolutely.
Okay, so that's something that at least healthcare professionals, could easily say. We could say, we can use the word "and." I mean, we can use
exactly. And you have ideas too. And
That's right.
Yeah, exactly. So don't block your off. Like, if you just say it, it's like, I was happy with the way it was the old way. No, I wasn't. It needs to be enhanced and improved, and yes, part of that has to be held accountable. Like if there's some questionable financing schemes going on there, or payment who are receiving money that aren't providing care, we're opposed to that, And let me just say something about this, because there is a general view by a lot of progressives that get defensive about this Republican attack on fraud and abuse. They almost want to not talk about and change the subject. Okay. Democrats should be more mad about fraud and abuse, because they believe that government has a place in this world. And if it's not held accountable, that undermines the public's confidence in the ability to deliver the care, and it doesn't get to the care of people who deserve it. Now, people have to hear that. Okay. They have to see that you're angry too about this. Not that you're trying to hide it or pretend it never existed. It exists in the private sector too, by the way. But you have to say, it's outrageous, of course. And that from now on, and this is what I'm going to do. And that's part of the reimagination. Part of that is the word accountability. And so I'm probably getting too excited about this, but I get frustrated, because, you heard Congressman McGovern talk about, there's a lot of people who are frustrated with Democrats too. And part of that is you don't walk the talk, you gotta deliver. You gotta deliver. And it's gotta be accountable. And we don't have unlimited resources. You gotta focus the dollars on the needs that we know we need to have. And he also said concurrently, we're spending, he didn't say this word, but you and I both know, we're spending 2 times what most every other country is paying per capita, and we're getting poorer outcomes. Of course we need to do better.
So what I heard, so far we're in agreement that we're saying we're going to reverse the cuts and restructure the health system to have it more accountable. Fair so far?
Yes.
Okay. So now,
I would reimagine to be accountable, and also not just more accountable, but to address people's real needs. Yeah, absolutely. Sorry, go ahead.
Perfect. So now I want to go into a subset of that. You know as well as I do, even though it's not widely reported, and I'm going to ask a question about this as to how to go about it, because I myself, I'm not sure, is that the VA is slowly but surely getting killed.
Mm-hmm.
It's being decimated. And so the question is, because VA is a popular program, and VA is a program that should exist, and VA is the VA health system,
right?
We're speaking about is how can any observations on that? Do you agree with that? And B, how can we bring more attention to that? Because that could really make a difference in some of these swing districts where the VA is an important part. I'm still having a little bit of a challenge as I think about it from a strategic point of view as to how we should get that issue a little bit more visibility. I'm wondering if you have any thoughts about that. Or maybe you disagree.
Well, um, it kind of depends on the objective of the what's the goal here. I believe there are absolutely major shortcomings, and people need to convey their concern and support for veterans. But I don't believe that people believe Republicans and Democrats really significantly differentiate themselves on that. I like if you're making a political thing, I think they trip over themselves trying, whether it's truthful or not, they trip over themselves demonstrating that they care a lot about this. And frankly, they have been resourced, all sides have been resourcing the VA. Now, how they've been allocated, have they done it efficiently? Have they done it productively? Has the system been, we used to have in the late 90s the most advanced healthcare system in VA in terms of technology. Now we're way behind, and that needs to be upgraded and changed, and that they're in the process of trying to do that. But if you're talking about, I want a differentiator, I think it's on other issues, frankly.
Got it. Okay, that's fair. And what are those issues from, in addition to that sentence that we put together?
Healthcare. I think you've said it, like, again, healthcare it's not a privilege. It is a right, number one, and everyone should be covered. But I think also, I just want to say, as I began the conversation, I was talking about, before we start prescribing the policy, we effectively diagnose the problems where we meet people where they are. So they hear that whatever policy that you're trying to promote is going to address some of the problems they perceive are the primary issues. And the two that I think right now, even more so than coverage, are cost and complexity. The public is extraordinarily frustrated with the cost of healthcare and also the complexity of navigating through it. So if I had to pick any two issues as the definition of healthcare, and what's great for for the clinician world is there's no one who knows better about complexity than they do, about prior authorization and navigating through things and what insurers do and all their, again, meet them where they are, but make it not just about the clinician experience, but how that affects the patient, that sort of thing. So but again, I would frame it around cost and complexity, even before coverage, because one of the vast majority, let's just say, 90% of Americans, give or take, have health insurance now. Okay. So if your first debate is about coverage as opposed to cost and complexity, you're not addressing the 90% problems with health insurance, right? So I'm focusing on that. Since we've had success in the Affordable Care Act, we've significantly expanded the number of people. Now, in the next 2 or 3 years, we're going to see a lot more people uncovered, and the issue of the uninsured is going to come back again, in my view, Norbert. But right now, today, it's cost and complexity. And any definition of the problem should be focused around that, to make the point about what that means to people, what it means in terms of reduced access to care, in terms of how people hesitate to get care, et cetera, and how they navigate through care. And then your policy prescriptions have to begin to explicitly address that, as many of your policies do. But connect the two. And I think we go quickly to the prescription before we've met the people. And I think if you do that well and you've got your white coat on, boy, you're further ahead than most members of Congress.
I just want to ask the A&D team if there are any questions in the chat for Chris. I'm going to go to my next question, actually comment, and then next question. I just want you to know, in our practice, which has 15 or 20 healthcare professionals, we have 2 people full-time working on prior authorization. that is a huge
It's
amount of money.
outrageous. Yeah. Yeah.
And it's not just the fact that there are two people who are working on this full time, but the amount of time that I
Of
have to
course.
spend,
Yeah.
you know,
Through documentation. Yeah.
the documentation is just so I myself, just from a policy point of view, I have no problem per se with prior authorization. The problem that I have is that they're totally inconsistent. And I still don't understand why we, as healthcare professionals, I know the AMA talks about this, but somehow we have not been able to make a sale on that, to say, look, if you want to have prior authorizations, that's okay, but at least make them consistent across the board. Whereas there's just constant changes across every different insurer. And that makes, frankly, that makes me crazy.
Yeah. Yeah. Well, of course. And that's a great example, but there's 2 points to that. One is not just it's inconsistent, and it's applied to things that make no sense to have prior authorization as well. And it also, the impact it has on denial and delay of care to patients needs to be highlighted too. So it's the imposition of unnecessary paperwork and time for clinicians, which means less time for patients, but it also means for the patients, sometimes denial and delay of the care that they need. So that just needs to be the full circle, the full gamut of the implications of that. Now, one last point. On prior authorization, I actually think you all have begun to break through on this. I mean, I think this issue more and more, even this is another example, Norbert, where Republicans, particularly the MAGA Republicans, are far more hostile to insurers than the old Republicans used to be. Okay. And so they're more willing to hold insurers and PBMs and the so-called middleman much more accountable, which you should use to the
Sure.
benefits. And that's another great example of bipartisanship, I think, that exists. Another one actually is something that we really need to do, which is physician payment reform in the Medicare program. So there are what I call hugely important, but secondary to the normal political debate around healthcare, that are doable, bipartisan, bicameral, and should be done. And in fact, I would argue early next year, early 27, some of those issues that I've just raised could get done. And then we'll go straight to another presidential debate, and then it will all be about differences and distinctions. But so I would open up that door as you're defining the broader issues and priorities that you want to outline.
So what I heard before I come to my last question is what I'm hearing in terms of messaging is that we as health professionals have to talk and walk a conversation of cost and complexity, and then we can tie together reversing the cuts in concert with an accountable
Reimagination,
restructured, and with new imagination healthcare system. That the messages that what
and I think it's even more important for elected leaders, before they give the prescription, to demonstrate they understand what real people are going through with your help. And they should cite you and patients as they're making the case. And then they should get personally enraged and engaged to promote a policy intervention that will make a difference. But if you go straight to some sort of policy on anything, people's eyes glaze over. They don't even believe you. You're not angry enough. You're not going to do anything. And it's about you, not me. It's not about us. It's about you. And so anyway, that's my hopeful takeaway.
Great. Well, we're on the same page, and this has been so helpful. I was born in Italy, Chris. Not many people would, and I speak Italian fluently, and I laugh at everything at the end of the day.
Yeah.
And as part of my appreciation of who you are and what you've done, can you tell me something over the last few decades on these tough issues, which are just so difficult, that has made you laugh, a good belly laugh, or any story that you'd like to share with us as we close out this hour? Because I always try to start on time and I end on time. And I want to really
Okay.
thank you in
Well,
advance.
thank you. Well, all right. Well, I'll give you one that, usually they start with painfully and then they end up in reflection laughing. Okay. That sort of thing. But so you will recall, because you are of age, that in when I was mentioning the fight and the closing down the government over the contract with America that the Republicans were talking about, Medicare, Medicaid votes, I was working for President Clinton, and I was quoted in the New York Times as in basically saying these cuts that they're proposing are outrageous and they're wackadoo. And I had all sorts of negative things that they'll hurt people and all the rest. I mean, it was pretty factual. But I was in a meeting in the White House, and Chuck Grassley, who you've heard of, he's
still around.
He's still around. He's in his 90s. He was the chairman of the finance committee, but he was on the, and he went to the Senate floor, and I was in this meeting, and I got this page, and it said, Chuck Grassley is attacking you on the Senate floor. And apparently he was down there saying, who is this Chris Jennings? What does he know about healthcare? Okay. And he was going on and on and on. And I was like, oh, what can I do about it? I'm in a meeting and then I'm sitting there. I go, oh God, I hope I'm not in trouble. And then my old boss, David Pryor from Arkansas, who you may have remember, he's former chairman of the aging committee. And he goes down and he defends my honor. And he says, you want to know who Chris Jennings is? He's the most thoughtful, committed, responsible. I would suggest that you even know who he is. I can't believe that you would take his name and honor and blah, blah, blah. And so, but the next week I had to go see Chuck Grassley, and he didn't know who I was. Of course not. Why should he? And I said, Senator, I just want to introduce myself to you. I'm Chris Jennings. I'm the one you attacked on the Senate floor. And he said, oh, I'm so sorry. I'm so sorry. And I said, no. I am so happy that my boss went down to defend me on the Senate floor. And so it's fine. And really, right after that, we ended up working together on an issue. So it kind of what goes around comes around. And it was something that I look back with a smile, because my old boss had the temerity and the thoughtfulness to go defend my honor.
Well, this is a good bipartisan note to end on, because we can fight and this and yell and stamp.
Yeah.
But if we're going to get anything done, Chris,
well, it just goes to show you, right? Once you know a human being, it becomes a little bit harder to
So let's continue to work together. Look forward to staying in touch. Thank you so much for being on tonight. And, let's look for better times ahead with more health coverage for people in a restructured, imaginative, higher quality system. Thank you so much.
You got it, Norbert. It's my pleasure. Thanks. You look great. Keep up the great work.
Vice versa. Back at you.
All right. Take care.
Right.
Bye-bye.